we still have a couple of minutes before we start. Please make sure that you're sitting on a chair which has a voting pad so that you can vote with that, because we don't allow verbal communication. So voting pad is required. If you're not on a chair with a voting pad, you have two choices. You can either move to a chair with a voting pad, which is easier, or raise your hand so that people in red t-shirts can come and give you a voting pad. There are lots of empty chairs with voting pads already inbuilt. Unfortunately, this is a quiz where you get to take nothing home except 3 prizes. So voting pads will have to be returned back to the people from whom we've hired them. The red t-shirts will stay on the bodies of the Entod people. Please don't take anybody's t-shirts home. Are there any still without voting pads? There are chairs in the front with empty chairs with voting pads. You can occupy them. The signal from the chairs in the front reaches a nanosecond earlier than the other signals. Can we have the slides projected? I have no idea what it is. This is to introduce Dr. Namrata Sharma, who will be my quiz master. I really don't know gender-wise. What did you say? Quiz ma'am, quiz... Quizzer, we'll just say quizzer. Is everybody settled down? Use only one voting pad per head, because 2 doesn't help. We give prizes only to one voter at a time. Also, please remember that spouses will not get prizes. If both of them come first, second, or second, third, they will not get. Only one of them will get. If there are 2 people from the same institution sitting next to each other and they get prizes, only one of them will be given. So if you're from the same institution, it's better that you spread yourself apart. We have got a bird's eye view from here. Dr. Namrata actually has 6 by 6. I have got cataracts coming in, but she can spot these sort of things.
6 by 4.
6 by 4, all right.
One eye 6 by 4, other 6 by 5.
Yeah.
Seriously, not joking.
Tags are not there.
You know.
There are more tags to my left on that side. So there are some of you who are sitting here without the tags, without the voting pads. Move on to that side so that you can use the voting pads. Yeah? Let's settle down quickly so that we have more than 50 questions to be asked. And then poor Dr. Namrata will have to answer another 50 questions in the general body meeting to follow. So
more than 50,
more
sir.
Than 50 questions. Is everyone seated with a voting pad in hand? Anyone without a voting pad in hand, please raise your hands. Yeah, come this side. Front row, that side there are seats. Get a little cardio, walk to that side. You announce.
So these are the prizes, and from next year there'll be no cash prizes. So this is the last year when you can get cash prizes, because it has been decided by the various meetings that we've held that there won't be cash prizes from next time. Of course, some other form would be there. So this is your last chance to win any cash prize in AIOS. So the first prize is 50,000, the second prize is 30,000, and the third prize is 20,000.
So you're aware that the quiz masters are standing in front of you. The chairperson of the scientific committee, currently Dr. Partha Bishwas, and the future chairperson of the scientific committee is also standing here and taking part, Dr. Namrata Sharma. Yeah, so we have the past and the future with us. And we thank Entod for sponsoring the AIOS Entod scientific quiz. There'll be a total of 55 questions. Each question will have 4 possible answers for you to choose from. Time for you to answer is 15 seconds. Please start the click only after the clock starts over there, because anything recorded before that will not be useful. And once the time lapses, don't click, it doesn't make sense. So you can change your mind, but the last recorded answer will be final. You can pass because there is no negative marking. So if you don't select anything, the computer G will just say that you have passed. So that is as simple as that. And we will test you with some 2 dummy questions first. So the first dummy question is, which is India's fastest growing dry eye therapy brand? And is it Aios DS, Myatro, Hyla Fusion, or Lacril Ultra? And the time starts now. Next.
So the answer is written there actually.
So you see the timer and the numbers.
So they're trying to make you remember the product rather than ask you a question.
Yeah. So it's amazing that Entod needs to do some more homework. On only 28% people felt Hyla Fusion was the correct answer. Okay. The second dummy question is it's a dummy question, so obviously these are not counted. The correct answer, yeah, okay. So this is how the pattern will be. You'll get the question, you'll get the correct answer, and you'll get the bar diagram which will show how many people answered correctly. And second dummy question, which Entod pharma brand to achieve rapid mydriasis and sustained intraocular anesthesia on the operating table? So which brand of Entod is it? And these are your options, and the timer starts now. Okay. And we are now inching closer to getting correct answers coming up more often. So we hope this trend will continue. And of course, the correct answer was Phenocan Plus. So we'll go on to the actual quiz. Is everybody ready with voting pads? If not, please put your hands up quickly for the last time. Gentlemen here and 2 people behind, voting pads, please. One gentleman here. Yeah, just see that he gets one. Team is coming. 2 people there. Yeah. So do participate in the quiz. Even if you feel you don't have the right answer, press the buzzer. It doesn't matter. 1, 2, 3, or 4 are your choices, because there's no negative marking. We'd like everyone to participate rather than just sit and enjoy the questions. Okay? Sir, did you get your, not yet, put your, one here. 2. 2 here. Yeah. 2 here, and then we'll start. I think everyone else is in. Can we have 2 this side? There? Finished? Over?
We have a 250 voting
Yeah,
pads,
yeah.
but extra we take the 30 voting pads.
Okay.
Okay, so now there are no voting pads to get. So all those who are captive inside will use it, and we can't offer others because
Sorry,
they're over.
enjoy the quiz without the voting pads. Yeah? Okay. Okay, so we'll start with the first question. Everyone who's got, yeah. There is one pad there. Can you disconnect and use it, please? Don't waste pads. Come there. Yeah, it's stuck.
One here.
There's one more here.
So everybody's
Is there one
pad
more?
hunting now, voting pad hunting.
Is there any extra near you? One more? Sir, can you come this side? Can you move this side?
All the inputting chairs have a
Okay. If anyone can spot a spare voting pad, please let us know so we'll direct people accordingly. Okay, we must start now. This is to convince you about who the sponsors are today. And we'll start with the first question. Remember, you'll get 15 seconds. And LHON, Leber's hereditary optic neuropathy, is paternally inherited, maternally inherited, a cause of unilateral blindness, or causes bilateral peripheral field loss. Which of these is true? Your time started. Punch 1, 2, 3, or 4. Yeah. And the correct answer was that it's maternally inherited. And the 64% of you got that right, so we are doing well. So good beginning. I request members of the audience not to give out the answer because in 67% of cases it's the wrong answer and it misleads the rest of the audience. Trust me, I will give you hints which will be much easier to follow. The commonest malignant lid lesion in the Indian population is a sebaceous gland carcinoma, squamous cell carcinoma, basal cell, or a malignant melanoma. Which of these is the commonest lesion? And your time starts now.
These are your questions only.
I think so. Yeah, come. It was evenly divided between the first three, which is great. And in India, the commonest malignant lesion by far, there's a huge gap between number 1 and number 2, is the sebaceous gland carcinoma. Cervico-oculoacoustic syndrome was first described by Goldenhar, Wildervank, Klippelfeld, or Bardet Biedl. Please, what happens is you're tending to mislead the population. Time starts now. This is not an oral quiz, it's a finger button quiz. Unfortunately, sir, as I said, number 1 is not the correct answer. 75% of you got that wrong. Please understand that whenever you think it is 100% correct, it is wrong. As far as I am concerned, it is designed to mislead. So the cervico-oculoacoustic syndrome was by Wildervank. We don't debate, sir, because the quiz master's decision is final and we have a finite amount of time for the quiz. Who introduced the single port vitreous infusion suction cutter? It was called Whisk in 1970. Was it Skippens, Tolentino, Steve Charles, or Bob McKemmer? And your time starts now. 52, 53 years ago, this gentleman, all these are gentlemen, none of them is a lady. And the time is over, and the correct answer was Bob McKemmer, and almost 37% of you got that right. Yes, Bob McKemmer introduced this very bulky instrument. Prashant has seen this and perhaps played with it as well. Leishmaniasis is a parasitic infection. I'm giving you that. It's spread by the bite of what? Male mosquitoes, female sandflies, worker bees, or dragonflies. So it's one of these parasitic infection is caused by which bite? And your time starts now. And 71% of you realize that the female of the species is always deadlier than the male. So the correct answer is the female sandflies, nasty creatures. In congenital stationary night blindness and X-linked retinoschisis, there is abnormal ERG and normal EOG, or in some of the other combinations. Which combination is correct as far as ERG and EOG is concerned? And your time starts now. And usually when it's eeny, meeny, miny, mo, choose between 2 and 3 because I put them in the middle somewhere. Except this time. When it is an abnormal ERG and a normal EOG. Yeah? Okay. So in ultrasound in choroidal hemangioma, internal reflectivity would be medium, low, high, or absent when you're doing a B scan ultrasound. And your time starts now. Hemangioma will give or will not give any reflectivity. And 42% of you all got that right, that it will be a high reflectivity. Almost everything will give reflectivity on B scan. So if another question comes on B scan and is absent, don't choose that. Which of the following about benign choroidal osteoma is false? The deposits are mature cancellous bone. They rarely cause blurred vision. Common site is around the optic disc and it has well-defined borders. 3 out of the 4 are true. You have to determine which one is false. Time starts now. And I expected a nice crossover from all these. It rarely causes blurred vision is false. It does cause because it's at the posterior pole, so it does cause, but it is mature cancellous bone which is actually formed over there for God knows what reason. Okay, so that was false. Duane syndrome type 3 is characterized by absence of retraction, limited adduction, limited abduction, or limited abduction and adduction. Which of these? And your time starts now. This is Duane's type 3, so this is a straightforward giveaway. And hopefully, yes, 73% of you got that right, that it's Duane's type 3 because there is both abduction and adduction are both limited, unlike in Duane's 1. Glad. So we slip in these questions to keep your spirits up and to prevent you from leaving the hall before the first 10 questions. The first female president of AIOS. Dr. Sudha Sutaria, Dr. Vasu Kalevar, Dr. Anita Panda, or none of the above. So you have a choice, and your time starts now. And 48% of you got that right. It was way back in the 1950s that Dr. Miss Laker was the president. I think it was 1954-55 that she was the first female president way back before women's emancipation. So we were, as a society, we have been much more emancipated than the US. Now we'll have a leaderboard now. So So we finished 10 questions. I think we finished 10 questions. Okay, so at the end of the leaderboard, we've got people in contention are those with 4 out of 10 are still in contention, which is not bad. Oh, this was, okay, yeah. Yeah. All are true of Panem's space. Panem space, one of these is false. It's a zone in front of and behind the horopter. Panem's area is wider in the periphery. All objects in that Panem's area stimulate corresponding retinal points, or stereopsis exists in this space. 3 out of the 4 are true. Which one is not true? And your time starts now. And 33% of you, 1/3 of you got that right. Is it? Yeah. So all objects stimulate corresponding retinal points, and that almost 1/3 of you got that right. And this is subliminal advertising. You can close your eyes and blink in between so you don't get dry eye whenever these sponsors' messages come to you. Next question, the mutation of which gene is associated with aniridia? Only one gene which causes aniridia by mutation. These English letters of the alphabet, is it 1, 2, 3, or 4? I won't read out to you. Okay, some of them are my invention, some are actual genes. And it was, I think, a eeny, meeny, miny, mo type of thing. And the correct answer was the PAX6 gene. And 80% of you got that right. Wonderful. All are true of rhino-ocular cerebral mucormycosis, except orbital involvement is less than 50%. It starts from nasal mucosa. It's caused by opportunistic fungi. And periorbital edema is non-tender and lax. All are true except one of these, and your time is now. One of them is not true. I think the answer was actually staring at you, and 32% of you got that right. That orbital involvement is in more than 50%. Otherwise, why would we bother putting the word ocular in the middle? You know, it starts from nasal mucosa. If the orbit was not going to be affected, they would have dropped that name. People don't like to name us. Vitreous hemorrhage following aneurysmal subarachnoid hemorrhage has a specific name. It's called Terson syndrome, Hyre syndrome, Lytten syndrome, or Tolentino syndrome. Specific, the cause of vitreous hemorrhage is following a bursting of an aneurysm, causing subarachnoid hemorrhage and then a vitreous hemorrhage. And your time starts now. And the correct answer is Terson syndrome. Dr. Sohan Singh Hyre was a legendary figure working in many of these fields, but Terson beat him to it and got his name on the syndrome. So it's Terson syndrome, and 63% of you all got that right. But at least for nationalistic reasons, some more should have used Hyre. I'm extremely nationalistic, so whenever there are 4 and there's an Indian name, usually it's the Indian name which is the right answer, except now. This Brigham test is used. It's a new visual field test. It's a test for myasthenia, for macular function, or CSF pressure in BIH. And your time starts now. Brigham. And the correct answer, it's a macular function test. It's nothing to do with anything new. You never heard of it for myasthenia, and not for CSF pressure either. And it's a pretty old test. It's nothing new. It may be there in Sir Stuart Duke Elder's book. Children with Down syndrome have nystagmus, hyperopia and astigmatism, exotropia, cataract and poor accommodation, keratoconus, nasolacrimal obstruction and glaucoma, or all of the above. They're pretty miserable, so I would go for all of the above actually. But let's see, your time starts now. They have lots of things happening to them. Which combination more likely? And I hope 56% went by logic, which is all of the above, but they're bad but not so bad. So actually they have nystagmus, hyperopia and astigmatism, which is very common. And the others are not so common. Okay. Fibrillin, opticin, and glycosaminoglycans, better known as GAG, are found in the vitreous, in the aqueous, in the trabecular meshwork, or the crystalline lens. All these three are found where? And your time starts now. And the correct answer is the vitreous, where they are found. Aqueous is too thin, mainly pani. What you'll find all these sort of things inside. Huh? A popular Japanese IOL, which was called the spider lens, was named after Kinoshita Nakajima, Sano, or Akira Momose. And some of those in the audience here have used that lens as well. So they will have no difficulty, and your time starts now. It was actually made of glass. And Akira Momose, he founded the Indo-Japanese Friendship Society and invited people from India to go there and learn how to use this lens and other lenses. Great friend of AIOS. The following are true about Entirion. I have no commercial financial interest. Entod has no commercial or financial interest in Entirion. Following are true. It's a swept source OCT, has a speed of 10,000 scans per second, has a 1300 nm light source wavelength, and can measure axial lengths in the range of 14 to 32. All are true except one. Your time starts now. There have been papers published this time and read out on the Entirion, and the correct answer has a speed of 10,000 scans per second. I think it is over 100,000 scans per second is the speed for the Entirion. And what happened to did they give how many got that right?
So it was kind of similar, 27, 29, 20, something like that. Yeah.
Okay.
It's almost similar.
Yeah, okay.
29,
okay.
27, 25.
Padma Shri Dr. Gulapalli Nageshwar Rao, did his residency training at RP Center, LV Prasad Eye Institute, Tufts University School of Medicine, or Sarojini Devi Eye Institute in Hyderabad. His residency was done where? Okay, and he's been around and he's luckily not in this hall, so you can't ask him this, and your time starts now. There was a whole IGO article on him with him on the cover. I hope all of you got that right. That means you're reading the journal, but no. 19% of you all actually thought that the institute which he founded, he did his residency training. So he first founded the institute, then did his residency training, became the first person to pass out, and then named it after LV Prasad. That is amazing. And only 26% of you thought that he did it from the RP Center. I've got a lot of his batchmates I've talked to, and they've confirmed that this is true. So it was the RP Center where he did his residency under Dr. LP Agarwal, for whom he's always eternally grateful. In every forum he mentions that. Leaderboard, yeah. So scoreboard is still, so the 10 to 20 didn't help. The highest is still 8. It was 6. So those who are 6 have got 2 out of 10 right in the next 10. Let's hope you can, we got easier questions coming up. In the primary position, the primary action of the superior oblique is extorsion, elevation, depression, or intorsion. Again, this is very straightforward textbook question. Your time starts now. Primary position. I expect more than 50% of you to get this right. And the correct answer was intorsion. And yes, 70% of you got that right. We were always taught that the inferiors are extorters and the superiors are intorters. So that does help. In dry eye, tear osmolarity of less than a particular value is considered normal. 208, which is the cutoff value. So the more osmolar it is, the drier the eye is. So which is the cutoff? 208, 308, 258, or 358 milliosmoles per liter. And your time starts now. This is an expensive test. We don't do this test because there's only one company, Tier Lab, which makes this, no financial interest. Hopefully, again, you will score in this. And the correct answer was 308 milliosmoles, and majority of you got that right. Okay. So again, it's usually when I put this, it's somewhere in the middle, not the two extremes. You discard and choose the middle ones. Contractile movements of the disc are seen in morning glory syndrome, disc drusen, optic nerve hyperplasia, or none of the above. See, if you've never seen these, then I would go for none of the above. How silly to have contractile movements of the disc. But let's see, your time starts now. And the correct answer is morning glory syndrome, in which you actually do see these, and people have recorded these, and it looks glorious. Trabeculectomy was introduced by Dr. Stallard in 68, Dr. Stallard in 58, Dr. Cairns in 68, or Dr. Cairns in 58. So choose first between Stallard and Cairns, and then choose 58 or 68. So you have only two choices actually. And your time starts now.
So I think they don't know any, so they'll just
You can
randomly
do eeny, meeny,
choose
miny, mo.
any.
Yeah, eeny, meeny, miny, mo.
This is too primitive actually.
And the correct answer is Dr. Cairns. He is from New Zealand, and he came out with this trabeculectomy for the first time. Before that, they had Shay's operation, some other filtering operations, and he came out with this. Dehlen-Fuchs nodules are seen in Fuchs endothelial dystrophy, sympathetic ophthalmia, leprosy, or von Recklinghausen's disease. Dehlen-Fuchs nodules, and your time starts now. Yeah, it's not too much seen because sympathetic ophthalmia has come down. So it's in sympathetic ophthalmia that it's been classically described, Dehlen-Fuchs nodules. Which of these is not a minimally, just to contrast with from 1968, we are bringing you to the present. Which of these is not a MIGS procedure? Cahook dual blade, eye stent, trabeculectomy, and Conan single blade. 3 of these are classified as minimally invasive glaucoma surgery. 1 of them is not. Time starts now. And the correct answer, 51% of you got that right. Conan single blade. I associate Conan with Conan the Barbarian in comic strips that we used to read. Nothing to do with MIGS. In the Bellin ABCD grading system, Bellin is a chap who works with the pentacam. Okay, so giving you a hint, C refers to the thinnest location, the curvature of the anterior cornea, curvature of the posterior cornea, or corrected visual acuity. Nowadays in pentacam, people refer to the Bellin display and the ABCD. They're just 2 things they look at, and which of these is C referring to? And your time starts now. So again, Michael Bellin has been coming to India quite often, and he's been our guest at AIOS as well. And the correct answer is that C refers to the thinnest location in the pentacam. CK3 is a specific marker for which cells on immunohistochemistry? Conjunctival epithelial cells, keratocytes, corneal epithelial cells, or goblet cells. And your time starts now. So there are some markers in immunohistochemistry, CK3, CK5, these are some of the markers that they use. And 28% of you got that right. It's the marker for the corneal epithelial cells. So when we are trying to find out if there is conjunctivalization, if the conjunctiva has grown or there is actual corneal phenotypes, we use this with impression cytology and check the CK3 markers. Pythium keratitis, quite a dreaded disease. Which of the following is true? One of them is, only one of them is true. Culture positivity is high. It responds to antifungals, lacks ergosterol in its cell wall, and on direct microscopy, it shows septate filaments. Only one of these is true about this dreaded disease called Pythium. And your time starts now. And 50% of you got that right. It lacks ergosterol in its cell wall. The others were not true. There's a peculiar syndrome called 1.5 syndrome. It refers to exudative total RD in one eye and lower half of the other eye. Unilateral horizontal gaze palsy and internuclear ophthalmoplegia, hydrops in one eye with keratoconus form frustrae in the other, or vertical gaze palsy with internuclear ophthalmoplegia. It goes by the name of 1.5 syndrome, and your time starts now.
Using this one. Feature.
Yes. And 68% of you got that right. Very good. It's unilateral gaze palsy and internuclear ophthalmoplegia. The medial longitudinal fasciculus is the one which is affected, causing this. And we go on to the next leaderboard. And yes, you have improved. So 6 out of the next 10 were right by the people who are leading. Let's go on to the next set of 20 questions. And to take you through that, we have Dr. Namrata Sharma. Yeah. Go ahead.
So the next question is, this is a scroll sign. Scroll sign is described for what? Anterior capsular tear, posterior capsular tear, Descemet's membrane scroll, Descemet's membrane detachment. And your time starts now. So the correct answer is, it is for posterior capsular tear. It is the sign that you see on the anterior segment OCT, because the posterior capsule scrolls, and that is what you can see. Did we see the this thing?
Going. Yeah.
No, how many answered correctly? None?
It came.
Okay.
Only about 30%.
Okay, so what is the likely diagnosis? Buttonhole flap with epithelial ingrowth, microsporidial keratitis, corneal dystrophy, chemical injury. And your time, please, can we start the timer?
Yeah, it will start.
Actually, the visual should be there otherwise. Visual should be there on this. Okay, so 46, almost half of them gave the right answer, buttonhole flap with the epithelial ingrowth. So this is the right answer. We go to the next question. Question number 33 is, all of the following are true of dysfunctional lens index. Dysfunctional lens index is DLI, which is measured. All of them are true except objective lens performance. It is an objective lens performance parameter. It ranks lens performance on a grade of 0 to 10 points. It utilizes internal high order aberrations, pupil size and contrast sensitivity data, and it is generated by Schemflick based device. So the question is, accept, and can we have the timer please? This is fairly simple actually. So 30% have got it correctly, generated by Schemflick. Schemflick based device is Pentachem. This you can measure in the eye trace. The next question is, all of the following are features of in vivo confocal microscopy in patients with post-refractive surgery dry eye, except bead-like formation, branched and tortuous nerves, microneuromas, reduction in the density of the corneal dendritic cells. Again, this is except. Can we have the timer, please? And the correct answer is reduction in the density of the corneal dendritic cells. So Whenever there is inflammation, the corneal dendritic cells would actually increase and not decrease. The next question is, the ophthalmologist is associated, this ophthalmologist, have a look at him please, is associated with all except first IOL implant, onchocerciasis or river blindness, sympathetic ophthalmia, nutritional amblyopia. The timer please. So you have to recognize the ophthalmologist and then find out a thing which he is not associated with. And the correct answer is sympathetic ophthalmia. This is, of course, is associated with first IOL implant, onchocerciasis, as well as nutritional amblyopia. This is the sponsor's question, although have been flashed, but phenocaine plus injection consists of the following combination of components.
Let them read. 1, 2.
I think you can read it. I'll confuse you more if I read it myself.
Yeah.
1, 2, 3, and 4. So the constituents are same, it is only the percentage which needs to be looked at. I hope all of you have got this correct. The sponsor will be disappointed otherwise. So, the sponsor is disappointed. 16% only know the correct concentration. Identify the surgical procedure. Amniotic membrane transplantation, Tennant's patch graft, corneal patch graft, conjunctival graft. Please have a look at it very closely because the picture will disappear. Amniotic membrane transplantation, Tennant's patch graft, corneal patch graft, conjunctival graft.
Time starts.
And the timer.
Let's have at least one answer with 100% right.
So this is Tennant's patch graft.
Click.
And
Only
more
55.
than, yeah, it's okay. I didn't expect 55 to answer. So by that standards, it is
Okay,
fine.
Okay.
Question 38 is, which amongst the following is an endothelial dystrophy? Schlichting dystrophy, Waardenburg-Jonkers corneal dystrophy, Grone corneal dystrophy type 1, and Fleck corneal dystrophy. Which is an endothelial dystrophy? The timer, please. So that was a tongue twister kind of a thing. And it is
I expected even distribution.
It is actually posterior polymorphous, PPMD, posterior polymorphous dystrophy, where you have endothelization, epithelialization of the corneal endothelium, and this is how it looks like. Who implanted, now this is tricky. We all know who implanted the first intraocular lens, but who implanted the first foldable intraocular lens? Harold Redley, Nagahara, Kai E. Zhao, Charles Kelvin. Time, please. Okay, so the correct answer is Kai E. Zhao, and she's Chinese, and only about 23% knew the correct answer. Okay, Charles Kelman is with the phaco machine, and Harold Ridley is the first IOL implanted by him.
And Nagara invented the chopper.
Chopper. So you already know the next 4 quiz questions will be there in the future quizzes if we use this set of questions. Which of the following is the most common corneal finding of sarcoidosis? So I don't know whether the retina people would know this or the cornea people would know this. Is it calcific band keratopathy, nummular keratitis, thickening of the Descemet's membrane, or deep stromal vascularization? Timer, please. So the correct answer is calcific band keratopathy, and 43% have got it correctly.
And this is the leaderboard. Okay.
You can analyze
15,
the leaderboard.
12.
You can analyze the leaderboard.
Yeah. So in 40-15, so, okay.
So these are the last 10 or 15 questions now which are coming. Which of the following is not a presbyopia treatment? Alpha core, supracore, multifocal ablation, intracore. It is not a presbyopia treatment. Time, please.
This again, hopefully a majority will get right.
Okay, the correct answer is alpha core, and
Yeah.
okay, 36%, not bad. 36% have got it right. It is artificial cornea, so it is not a method of presbyopia correction. The next question is, which of the following would be the best choice for microsporidial keratoconjunctivitis? Chloramphenicol, fumagillin, galardin, paromomycin. Timer, please. So we like to give questions on pythium, on microsporidia, which are neither here nor there. You can't identify where to put it. So the correct answer is fumagillin,
47%.
and 47% of you have got it correctly. Bromocol PF is FDA approved for primary open angle glaucoma, primary angle closure glaucoma, presbyopia, capillary hemangioma. Timer, please. So the correct answer is presbyopia. It is a combination of carbachol and brimonidine. Bardet-Biedl syndrome is characterized by autosomal dominant inheritance. It is most common gene mutation is BBS10, post-axial polydactyly, normal IQ. Timer, please. So the correct answer is post-axial polydactyly, and the most commonly mutated gene is BBS1, 23%, followed by BBS10. Question 45, in how do you pronounce it?
In Cauchy-Bonnet
Carry on.
aesthesiometer, a shorter length of the filament used indicates what? Decreased sensation, increased sensation, wrong technique, or faulty device. Your time starts now. Again, hopefully, majority will get this right.
So the correct answer is decreased sensation. So you have to record the length, and if the sensation, the length would actually indicate that there is decreased sensation. Okay, next question is, primary visual cortex is Brodmann area. I think everybody should get it. Primary visual cortex is Brodmann area 16, Brodmann area 17, Brodmann area 18, or Brodmann area 19. Time, please. So the correct answer is Brodmann area 17, and 68% have got it correctly, which is very good. Now, based on standardization of uveitis nomenclature, that is sun criteria, worsening activity is defined by 1-step increase in AC cells, 2-step increase in AC cells, 3-step increase in AC cells, or 4-step increase in the AC cells. Timer, please. Total questions, 55. Total questions are 55.
55.
So we have to go.
I'll do the next 5.
Okay. So the correct answer is 2-step increase in the AC cells, and 60% almost have got it correctly. So the next question is, which of the following drugs is implicated in the pathogenesis of the following condition? Gentamicin, amikacin, vancomycin, or clindamycin? Timer, please. And the correct answer, I think, again is simple. It is vancomycin. It is hemorrhagic occlusive retinal vasculitis caused because of the same.
It caused huge hangama in the American Academy. It was called HORV, and there was big noise about whether it should be withdrawn, not withdrawn, so that type of thing. Yeah.
So question number 49 is, goal of National Program for Control of Blindness and Visual Impairment, NPCB, launched in the year 1976 was to reduce the prevalence of blindness from 1.4 to 1%, to reduce the prevalence of blindness from 1.4 to 0.5%, to reduce it from 1.4 to 0.3%, or to reduce it from 1.4 to 0.1%. Timer, please. So the correct answer is 1.4 to 0.3%, and almost 43% have.
Incidentally, our neighbor in Karkadoma, near our AIOS office, is the NPCB office. So Dr. Namrata went across quickly, got the question and answer from there, and came back.
So this is different. If you look at the rapid survey on the avoidable blindness, which was conducted in the NPCB during 2006-2007, it showed that reduction in the prevalence of blindness from 1.1 to 1% was already there. So the next question, number 50, indication for this technique: ptosis, Marcus gun jaw winking, congenital medial rectus palsy, or dry eye. What is the procedure which is being done? Time. Can we go at the back?
After this, we'll have leaderboard.
And the answer is, this is for dry eye, and the procedure is, it looks like for ptosis, but it is not. The procedure is neurotization of the anesthetic cornea using a sural nerve graft and supratrochlear donor nerve from the other side. How many of them did it correctly?
Okay, and
I didn't see that.
How many got it right?
30%.
Okay. Yeah, about 30%. We come to the last 5 questions in this round. This is also, I think, yours.
So
Yeah.
this is simple. 1.5 full rotation of Hesburgh Barron vacuum turbines will cut how much? 0.126, 0.300, 0.380, or 0.105 millimeters. 1.5 full rotation.
This cuts corneal tissue, huh?
So Dhanushree is already nodding. Okay, so the correct answer is 0.380.
Yeah.
So question number 52 is, the logo stands for, I think everybody should know this, NPCB, WHO, IAPB, or SiteLife?
And your time starts.
So yes, 60% of you have said WHO, which
Remember,
is the
no
right answer.
ophthalmologist put snakes in their logo.
This
Yeah?
is not mine. Is this yours?
No. Yeah, okay.
Acha, Ardens ratio. So calculate the Ardens ratio. 0.38, 2.58, 1.29, 1.26. It is actually written there.
Answer is given here.
I think we can skip this.
Let's get everyone 100%
Okay,
on this.
let's hope you all get 100%. The pleasure of having 100%
At least
for us.
100%, yeah. So when the answer is given to you, take it. Take it. It won't happen again and again. Next.
So second last question. Mechanism of action of the following eye drop. Increase reflex tear secretion, increase basal tear secretion, corrects neural damage, provides growth factors.
Time starts now.
Timer, please. So this is a nasal spray. The name of the drug is also written there. And the correct answer is it increases the basal tear secretion because this activates the trigeminal parasympathetic pathway and so increases the production of the basal tear film. It's used as a nasal spray for dry eye disease. And the last question, identify the correct sequence. Again, this is very simple. Here, halos, glare, starburst, glare, starburst, halos, halos, starburst, glare, and glare, glare, glare. Time. So the correct answer is glare, starburst, halos. And this is how they are defined, glare, starburst, and halos. And I
Okay.
think almost half of them got it correctly. So
with that, we come to the end of this quiz, and I invite Mr. Nikhil Masurkar and Raman Marke from Entod to please come up. Nikhil, come up. Raman, please escort Nikhil Masurkar up. And we are fortunate to have Nikhil with us to distribute the prizes. We'll have the, can we have the leaderboard? So we have keypad number 6. The third prize is keypad. When there is a tie, they count the number of the lesser amount of time that you've taken to score the same. So the keypad number 239 to please come up. 239, please come. Hello, yes, come. Yeah.
So देखना third prize.
Have some. He's coming. Okay. So this is just like the dummy questions. This is a dummy check. Just to look good on pictures. Yeah. Nikhil? Dr. Vishali Tomar from Guru Nanak Eye Center. Give her a big hand.
You are working as?
Senior resident first year.
Yeah. Yeah. Congratulations. Wonderful. Thank you. Please stay. We'll take a group picture afterwards. And can we have the leaderboard again? Second prize. Yeah. Keypad number 61. Wonderful.
Did you
Please
all
come.
simultaneously answer? Come.
Come.
All of them are sitting off one.
No, but if it's Guru Nanak, it's not qualified.
So what is your name? Please introduce yourself.
Hi, I'm Dr. Praveena. I'm a pediatric ophthalm fellow at Aravind Eye Hospital, Tirunelveli.
Wonderful. And
Is that the Arvind group there?
you need to point out the spelling mistake in this to get this. Perfect. 30,000. Okay. Congratulations. Okay. And can we have the leaderboard again? Can we have keypad 171, please? And it's a clean sweep by the ladies. Actually, Entod had disabled all the keypads used by the men.
Please introduce yourself.
My name is Dr. Ashima Vashne. I am from Sitapur Eye Hospital.
Wonderful. Congratulations. Look there. Wonderful. Congratulations. Thank you. Can we have all three of you with a group picture, please? Keep these down. Yeah. You will come in the middle. Yeah, come. Come. Nikhil, come. Nikhil, come in the center. The next entertainment program starts at 4 o'clock. It's called Annual General Body Meeting. It's in the same hall.